Everyone doing today? Thank you all for being here. Happy Tuesday. It's the last Tuesday in January already. Can you believe it? Just like that. I mean, it was December holidays, and here we are closing out the final week of January 2021. I want to welcome you on behalf of the Emory Alzheimer's Disease Research Center. Thank you all for joining us on this Tuesday. If you're in here in Georgia, it's pretty warm here and a little overcast, but we'll take 64 degrees any day, right? So let me tell you what you're in store for. I'll do a little bit of housekeeping. Today, our program really should be under 60 minutes. So while I'm going over housekeeping, this is a good time to share the email with some friends or loved ones or your neighbors, or if you have been joining us since March 31st of 2020, we have been hosting these weekly 1-hour programs to keep you informed, keep you engaged, and motivated during the pandemic. We're here for the long haul, and thank you to those who have been joining us each and every Tuesday from 2 p.m. to 3 p.m. Eastern. All right, so we do have a lineup for you today, and so we always begin with exercise because what's good for your heart is good for your brain. And so you need to get a sturdy chair because John Lewis comes on for about 8 to 10 minutes and he gets our heart going, he gets our blood rate and our heart rate going. And so we kick off every week with exercise. And then after exercise, you're going to hear from Dr. Monica Parker. She's going to be talking about memory issues, risk, and how to identify these issues and what are some of the interventions around memory impairment and risk. And for some of you, that will be a review. And for others, you may just need a refresher course. So go get your pen and pad so you can take lots of notes. The meeting is being recorded and we'll send out a PowerPoint of the slides. After Dr. Parker, you're going to hear from Whit Morgan. He's going to be talking about the Emory Healthy Aging Study. And what we have in store for us is we're actually going to have a participant come on and tell us about her experience as a research participant in the Emory Healthy Aging. She's going to walk us through that process, what it was like, if she had reservations like some of you all have had in the past. We just want you to hear firsthand from an individual who has had that experience and has walked through that research process and what you can expect and what her experience was like. And then followed by the research participant, Dr. Tolbert. You're going to hear from Matt Doiron. He is with the Cognitive Empowerment Program. And so for 2021, we're doing things a little bit different. We are having our BrainTalk Live every Tuesday from 2 p.m. to 3 p.m. And then immediately after our program, you can hop on the remote session with our Cognitive Empowerment Program. Okay? All right, so your Tuesdays are filled with a lot of great information, a lot of great content. So that's all the housekeeping I think I have. Remember, you can post comments in the chat or you can send in your questions through the Q&A function as well. Dr. Parker's on and she is available to answer those for you. So John, get us going today. We're saying goodbye to this last Tuesday in January. Get our hearts going, rev us up, get us motivated to hear all this information. We're ready when you are.
All right. First of all, I want to welcome everyone to the Emory Alzheimer's Disease Research Center today. If you want to sit down, you can, but we're going to do a lot of boxing movements to sculpt that body. And also, you can get cardio at the same time. So if you want to sit down, you can. If you want to stand up, you can. So I'm going to do a stand up, then I'm going to sit down. Oh, I can't even play my music. Thank you. All right, here we go. I need your hands up, elbows in. All right. Turn down. And remember, don't extend your arm. I want you to help hurt your elbow. Just enough to turn. We're gonna do 20. Y'all ready? And let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Now, when I use my right hand, I'm gonna turn my waist. All right, here we go. Let's go 10. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9. Look at them good lines. And 10. Good. Left hook. I bring the elbow and I come straight across. See that level? So we can get those lats, shoulders, and outer chest. 10. You ready? And go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right. For my right hand, I'm gonna slink a little bit and then I'm gonna hook. Up, ready, and go. 1, 2, 3, 4, 5, 6, come on, 7, come on, 8, 9, and 10. Great job. Shake it off, shake it off. Now uppercut, you turn and then come up. Turn up. Y'all ready? 10 and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Woo! Shake it off, shake it off. Our next one, sink, then up. Y'all ready? And let's go. 1, 2, 3, come on. 4, 5, come on. 6, 7, 8, 9, and 10. Great job. All right. Next one, left, right. All right, left, right, 10 sets. Y'all ready? Left, right, 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 2, left, right, left, right, 4, left, right, and 5. Good. Hook, 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 hook. All right, here we go. 10 sets. Ready? Go. Hook, hook. 1. Hook, hook. 2. Hook, hook. 3. Hook, hook. 4. Hook, hook. 5. Hook, hook. 6. Hook, hook. 7. Hook, hook. 8. Hook, hook. 9. Hook, hook. 10. Woo! Shake it off, shake it off, shake it off. Uppercut. 1, 2. I'm gonna rock a little bit. Rock so I can get that side obliques plus that upper body and chest. Y'all ready? 10 sets. Let's go. 1, 2, go. 1, 2, go. 3, 3, go. 4, 4, go. 5, 5, go. 6, 6, go. 7, 7, go. 8, 8, go. 9, 9, go. 10, 10. Great job. Y'all ready? Now we're gonna go left, right, hook, hook. You ready? Let's go. Left, right, hook, hook. That's 1. Left, right, hook, hook. That's 2. Left, right, hook, hook. That's 3. Left, right, hook, hook. That's 4. Left, right, hook, hook. That's 5. Woo! Shake it off, shake it off, shake it off. Now, what I'm gonna do is I'm gonna go uppercut, uppercut. Then I wanna go hook, hook. Y'all ready? Let's go. Uppercut, uppercut, hook, hook. 1. Hook, uppercut, hook, hook. 2. Let's go. Boom, 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 boom. 3. Come on. Boom, boom. Hook, hook. 1 more. Boom, boom. Hook, hook. There we go. Okay. I want to go continuous, but I'm going to go down first. Y'all ready? Continuous. Ready? And go. Boom, 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 boom. Come on. Breathe. Boom, 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 boom. Stop. Great job. Shake it off. Shake it off. We're going straight ahead now. Y'all ready? And go. Bum, 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 bum. Keep that chin down. Bum, 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 bum. Good. Great job. Come on, loosen up. We're going up at an angle now. Y'all ready? Set and go. Bum, 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 bum. Rest. Woo! We're gonna go hook down low, like if you was hooking in the ab area. But turn the waist, turn the waist. Y'all ready? And go. Boom, 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 boom. Keep them hands down. Come on, we scoped in the body. This is not traditional boxing right now. Boom, 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 boom. Good. Okay. I want your elbows up. And I want you to just keep them up in all waistline. Do lock your legs. All core. You ready? And go. Boom, 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 boom. Elbows up. Elbows up. Come on. We got to get that waistline. We're going to hold this one a little longer. I need this waistline. Come on. I need this waistline. I need this waistline. I need this waistline. I need this waistline. And stop. Great job. Y'all wearing me out right now. Y'all wearing me out. Here we go. I want you up at an angle. You ready? And turn that core and go. Boom, 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 boom. I don't want all arms like that. I want core. 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 And stop. Great job. Great job. Here we go. What I want you to do is cross down, but turn the core and cross down. Y'all ready? We're going to do 5. You ready? Let's go. 1, 2, 3, 4, and 5. Great job. I'm switching my legs for this one. Turn that core. Ready? And go. 1, 2, 3, 4, and 5. Great job. Now, I'm going to go up at an angle so I can get those lats and that core. Y'all ready? Let's go right side only. Ready? And go. 1, 2, 3, 4, and 5. Other side. Y'all ready? And go. 1, 2, 3, 4, and 5. Great job. If I had to push somebody off of me, I'm going to go boom. We're going to do both hands at the same time. Y'all ready? 10 of these, 10 of these. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We're really getting that chest, them shoulders, and that back. Okay, we are coming on at the end, and we're going to get our cardio in. Is that correct? We're coming on at the end and get our cardio in. So this last one, just keep up with me. We're going 10 seconds. Y'all ready? And let's go. 1, 2, boom, 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 boom. High, boom, 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 boom. Low, boom, 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 boom. Hook, 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 hook. Up, gut. Boom. Come on, come on, come on, come on. Cross down. Boom, 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 boom. Cross out, boom, 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 boom. And knock out. Hey, remember, take a break, get all the information in, and I'm coming back, and we're going to get that cardio in.
Wow. All right. Is your heart rate up? Are you ready to dive right in as we go over our information sessions for today? Every week we do a little something different, and John's energy is contagious. So we have him on every week to get us going and to give us really practical examples about how we can stay active at home and just in a chair. Isn't your heart rate up? Did you break a little sweat there? Just even if you didn't have gloves, your heart rate got going, and you were probably wondering, am I doing this right? Is this okay? Hey, as long as you are moving, movement is life, and we will always, always promote you being physical, being active. As we are aging, it's important to engage your core and keep your heart rate up and steady. All right, I see Dr. Parker is on the move. She is on campus today, and she's going to be sharing, as I mentioned, the risks and symptoms and updates about research with us today. So Hello.
Hey, can you hear me?
Hi there. All right. So let me get your PowerPoint going if you want to go ahead and introduce what you're going to be sharing with us today.
So, because we've been learning a lot about the pandemic, the COVID vaccine, and research, I think this is a good time for us to talk about Alzheimer's risk in research. Now, one of the things that concerns people are the side effects. And I'm going to go through a little talk. Some people, this is very familiar and it is a little redundant for you, but bear with us because everybody's not as knowledgeable. There are some risks that are associated with research, but before you participate, they're going to make you aware of what those different risks or side effects might be from whatever it is you're trying. With the COVID vaccine, you're learning that some of the side effects are weakness and some of the symptoms that actually might go along with the COVID infection. So similar things can happen when you're participating in Alzheimer's research. Any expected side effect is going to be discussed with you and explained to you before you actually enroll in whatever research study it is you're going to enroll in. So let me just go over some of what we do for Alzheimer's research and how is this different. I'm going to try to incorporate some of what we're learning about COVID research. And then pandemic has helped explain research a lot and you understand how important it is. But I want you to understand and appreciate that any kind of clinical research is important, whether it's Alzheimer's disease, high blood pressure disease, cancer, any of those kinds of disease processes. We're learning more and more about them. So what we try to do with research is keep people as happy, as healthy as possible. So let me go on into talk about Alzheimer's risk in research. So this is a slide that tells you about the different types of dementing illnesses or things that make your brain go kaplooey. Most commonly diagnosed is Alzheimer's, followed by Lewy body dementia, vascular dementia, Parkinson's, frontotemporal, and I have a little sliver up there called alcoholic dementia. In any one particular individual, you may find features consistent with all of those in any one individual. So what kind of dementia do they have? Do they have Alzheimer's? Do they have Lewy body? In a lot of people, as we get more sophisticated about how we diagnose dementing disorders, you may find features that may overlap with one or the other. So that's why your participation is important. For many people who are older and Southerners in particular, who live in the deep South, many of us suffer from high blood pressure, many of us suffer from diabetes, and many of us have had strokes. And that underlying pathology that's associated with vascular disease may overlap into some of these others. Next, please. So what are the main risk factors for Alzheimer's? Aging first, your genetics that you inherit from your parents, being female rather than male, and having a history of head injury or head trauma. And then finally, vascular disease, which I have alluded to a little bit earlier. Next. And lifestyle, okay? Sitting in an easy chair, eating a whole lot and drinking beer increases your risk for vascular disease or strokes. That's why we keep emphasizing exercise and we want you to work out with John Lewis. That's why we start out with exercise. And you learned that last week as well. Next. Cornelia? Okay, so this disease has been known about or kind of diagnosed since about 1900, early 1900s, when Alois Alzheimer's died. His wife, Auguste, died, and these were her symptoms. Keep going. But she had these symptoms that began at age 55. We would call that early onset Alzheimer's. The pathology is an accumulation of something called amyloid or A beta plaque and tau proteins. Next. So what are some of the symptoms of dementia? Now, whether you have Alzheimer's, HIV-related dementia, head trauma, you may have all of these symptoms. Memory loss, we all recognize, but I want you to appreciate that there are several different things that can cause memory loss. Repetition of words, stories, phrases. People are always repeating themselves. I was like, what does that mean? People always ask me that when I'm as a doctor. I said, it means that somebody needs an evaluation. Loss of bowel and bladder function, inability to independently take care of themselves, like dress themselves, groom themselves, toilet, feed, or manage finances and meals, prepare meals. My mother lost the ability to use a microwave. That's how we knew she was progressing. Somebody who's not walking well, somebody who's more likely to fall. And it's not just being a frail elderly person, it's the part of your brain that controls physical function that deteriorates and makes it more likely that you're going to fall. Personality changes and psychoses, people who become paranoid, people who start hearing things or seeing things that aren't really there. Those are symptoms of advanced dementia. Keep going. So behaviors, as a clinician, most commonly people start to look for a doctor's intervention or a doctor's assistance when they see these kinds of symptoms. When somebody's wandering, when somebody's urinating or going into doing things that are unusual and not normal, like driving difficulties, getting lost in familiar places. Keep going. So I always tell people, don't ask me a question, write down what you're seeing, make an appointment to see a doctor, a medical doctor who can assist you with the kind of evaluation you need to have. Don't try to correct the behaviors you're seeing, but if those behaviors may likely develop into some kind of harm for that individual or somebody around them, you need to intervene and try to control that behavior such that the person who is exhibiting the behaviors and the people in the environment aren't likely to be harmed. Okay, we have to do an evaluation to make sure that there's not something medical that's causing those behaviors. Sometimes people are on medications that they're taking improperly. Sometimes people need to be on medicines that they're not on. And we need to make sure that there's not a medical cause for their behavior that can be corrected. Okay, in addition to seeing a doctor, you may want to talk to like an elder care attorney or a social worker to kind of help manage some of what you see so that we can manage the person's safety and overall well-being. Now, research, we advocate research, but we don't want you to come into research if you have behaviors and other things that are going on that haven't been evaluated or assessed. Research can kind of be something of a gateway, but you won't be an effective research participant if you have some kind of untreated medical problem. I don't care whether it's dementia, diabetes, or anything else. We want healthy volunteers, and research is not a substitute for good medical care. Keep going. So when you get ready to participate in a study, how do you preserve yourself? How do you make sure that you're safe? Well, you have 13 questions up there. And the most important one I like to know is, why is the study being conducted? Because that helps you understand why you're participating. These are the questions you need to ask. Okay, is this a study that involves a medication or some kind of treatment that I wouldn't ordinarily have? And how is, if it's a treatment trial, how's this treatment going to be given to me? Is it something that I swallow? Is it something that I drink? Is it something you insert in my veins? Is it some kind of observation? But the main thing that you need to know is, what is the study is about and what is required of me to participate in the study. And number 6, I like, do I have to pay for any part of the study? Most likely not. More commonly, you will be given some kind of gratuity. I say gratuity because sometimes it's like a gift card or maybe a sandwich or a free lunch or something. And you shouldn't have to pay to be in any kind of research. For the educational outreach that we do, we ask for people to donate and volunteer money to help us put on and conduct the external programs that you see a lot of times. But in the course of conducting a study, particularly if it's a drug trial or a cancer treatment, there may be a side effect that you incur that requires you to go to the hospital to see a doctor. And in that case, your insurance may be used to cover the cost of evaluation and management of whatever symptom that is. Okay, but a lot of medical research does involve giving you money for reimbursing your travel costs or payment for gas, not necessarily for childcare, but possibly. Will I be able to see your own doctor? Of course. If you're participating in research, we like your doctor to be a partner with us here at the ADRC and let them know what you're participating in, particularly if it's a medical treatment trial. and the coordinator or the nurse who's doing or helping you with that medical treatment trial will give you information to share with your doctor so that that doctor is aware of what kinds of things you might encounter. The other thing that I want you to appreciate about research, clinical research, is that it's all volunteer. You don't have to participate. If you get to a point where something's uncomfortable for you and you don't feel you can continue, you just stop, okay? And finally, does a physician or investigator have any financial or special interest in the clinical study? I can tell you right now that I am not associated with any biochemical company, and I don't get any money from participating or recruiting people for research studies. In general, those of us who conduct the studies do not benefit financially or any other way from the study. We are given money by the federal government or NIA or NIH or the company that's sponsoring the study to help facilitate the study, but we don't get paid extra to conduct the study. Next, please. Okay. I don't think I have any more questions, but I think the most important thing that I can say to you, to put a toe into research, participate in the what we call observational studies, where they just ask you questions, surveys, things like that, where you don't have to give your blood, you don't have to do anything, but always ask what the study is about and what's required of you. And when they give you what we call the informed consent, they'll generally tell you all of that, but ask the questions that you think are important to ask before you participate in any study, and make sure that the questions are answered to your satisfaction. And if you are uncomfortable in any way, remember, research is voluntary and you don't have to participate. Thank you.
Thank you, Dr. Parker. Can we go back to some of the content you talked about earlier when you shared information about behaviors? One person is saying, what if the person is unaware of their behaviors and they're refusing medical intervention?
I think that that's one of the things that you have to be very gentle about. You have to be very objective about. And a lot of people aren't the best judge of what's best for them. So in concert with that individual's physician, discuss what is observed. And in families, particularly if there are male children and female children, whichever child is the one that the parents listen to the best is probably the one who needs to bring the information up. Because they may accept it a little bit better. But I always counsel families that when you see things that look unusual, make an appointment for your relative to go to the doctor and discuss what you are seeing, because that's the only way that you're going to get the proper kind of intervention. A lot of people may misjudge what their behaviors are, but if somebody else in authority that they have some respect for validates what you're saying, they're more likely to listen, and they may listen a little bit better. But again, if you see abnormal behaviors or things that look unusual, please document them, write them down, make an appointment for your relative to go to the doctor and discuss those things that you observe, that you have written down with the doctor so that the doctor can intervene. Chances are they don't believe their relative, but they'll do what the doctor says.
Mhm. Okay, such sage advice. All right. Well, we are going to transition to our next topic, and Whit, Morgan, and Dr. Myra Tolbert are going to come on and talk about the Emory Healthy Aging Study. If you've been on with us over the last several weeks or months, we bring this up quite frequently. It is a very seamless uh, opportunity where you can participate in research, and um, that's what we're going to be sharing with you today. Whit?
Thank you very much, Cornelia. And if I can, I would like to be able to share my screen real quick, just to give a quick show of our website. So for those that I have not met before, or this is your first time attending, my name is Whit. I am the communication specialist for the Emory Healthy Aging Study and the Emory Healthy Brain Studies. And we've talked a little bit about the Emory Healthy Aging Study in our previous webinars, but for those, like I said, are first-time visitors here, the Emory Healthy Aging Study is a really unique research opportunity. It is a longitudinal study that we are conducting where we are trying to basically better understand the process of aging, how we age, and what causes certain age-related diseases. And we're doing this by asking our participants to complete an online health history questionnaire once a year, and then update that health history questionnaire every year if you have any information that's changing. Now, I know it's called the Healthy Aging Study. This is actually open to anybody over the age of 18 who can read and understand English and who has an internet connection. The reason for this is because it's done entirely online. Like I said, it's just a single health history questionnaire. And on that questionnaire, we ask our participants different questions about their health history, such as, do you have any pre-existing medical conditions, any diseases? We also look at demographic information. We also want to know more about your lifestyle and your habits. We like to know things about how much exercise are you getting. We always start out these webinars with our presentations from John Lewis, and it's really important to get that exercise. We want to know how much of that you're doing. We also look at dietary habits. Are you eating your fruits and vegetables? Are you doing things that are good for your brain? And so our goal for this study, as I said earlier, it's a pretty big one. We're actually shooting to get 100,000 participants. So we got pretty lofty goals. We are excited to have reached a pretty big milestone here this past year, breaking 30,000 people that have registered. But obviously, we're not quite there yet. And one of the other things that we use the Emory Healthy Aging Study for is to identify potential participants that might be a good fit for one of our sub-studies, the Emory Healthy Brain Study. Now, the Emory Healthy Brain Study is a little bit different than our aging study. It does involve an on-site visit once every 2 years, and we have a little bit more stringent criteria on who is eligible to participate in that, because this sub-study is actually focusing on Alzheimer's disease and dementia. And our goals for this is to identify the biomarkers in our bodies that will help us better understand who's going to develop it or when they might develop it. And so we use some of the information that we collect in that health history questionnaire to identify potential participants, like one of the participants that's joining us today, Dr. Myra Tolbert, who's going to share a little bit about her experience in starting with the Emory Healthy Aging Study and actually becoming a participant in the Healthy Brain Study. And before I hand it over here, I always like to pull up our website so that you can see how you would go about getting involved in joining the Emory Healthy Aging Study if you wanted to. And that's done by visiting our website. As I mentioned again earlier, it's done entirely online. So you would go to our website up here, healthyaging.emory.edu. And then there's a big yellow button right here that says join the study. And it's a 4-step process where you would actually go and create your username for our portal. You would walk you through the consent. We collect a little bit of contact information in case we have to reach out to you. And then finally, we have the health history questionnaire. And I'm going to drop this information into the chat box as well, along with my email address. In case you have any questions, feel free to contact me directly. And so with that being said, I'll stop sharing my screen here and I will hand it over to our participant, Dr. Myra Tolbert.
Good afternoon. Thank you so much for having me to share my experience with you participating in the study. Let me first, with full disclosure, say I was very, very reluctant. Very reluctant. I had a friend who participated in another study, and she was telling me what a wonderful experience it was, and they didn't have enough people, and especially African Americans. And, I'm an educator, and she said, we're in education, and, we've done all of this research, and, now that we're retired, we just really need to give back. And my response to her was, okay, whatever. So she kept talking until she finally wore me down. And I said, fine, just submit my name. And I thought I would get her off my back. Well, to my surprise, I get an email from Emory saying, would you like to participate? And here's some information that they needed. So of course I filled it out. You know, I'm kind of a nerd. You know, it's now my interest is piqued. So I fill out the questionnaire and I think, that's it, I'm done. They asked me all these questions, underlying conditions, about my parents, who had cancer, who died of this, who died. I provided all of that. I'm not going to be a good candidate. Was I surprised? I get an email and then a follow-up call asking me would I like to participate. And again, I'm now interested. And there's something that Barbara said to me that really made me decide to do it. She said, you know, we always complain about, does this really apply to Black people when Black people don't participate? And I thought, she's absolutely right. And in her cohort, I think out of 100 people, there may have been 3 Black folks. And I thought, you know, I have to put my money where my mouth is. If I'm always going to talk about that no one's focusing on us, I need to participate. So I did. I have to tell you up front, I've had a good time. I've met some fabulous people. I've been scared. I'm sure when they took my blood pressure, they said, okay, something's wrong with her, but it wasn't high. I was very apprehensive about several things that was going on. One was the lumbar puncture. I must have talked to Chelsea 20 minutes about it before I actually was scheduled for it. And let me say this about staff. Staff is very alarming, very unalarming. They are professional. They know what they're talking about, and they know how to make you feel comfortable in what you're doing. So when I had to go in, well, the worst part of the whole thing is the cognitive. And we did that remotely. During all of this, COVID happened, so I couldn't go in. My thing is dealing with people because I can disarm people. But when you're over the internet, it's kind of hard to snow people that you know what you're doing and you're not scared. So finally, we do the cognitive ability. And that was the worst part, I have to say, of the whole experience. They had me counting backwards by 3. Who does that? I use a calculator. They had me remembering words. Well, who does that? I had memory on my phone. So I realized that I was becoming too dependent on electronics. So as a result of that, and this is all an aside of the experience, I now limit myself from using all of the electronics. Maybe an hour a day, that's between checking email, playing games, and all of that stuff on either the iPad or my laptop or whatever. I do all of my addition by hand, you know, like we learned in school, as opposed to using the calculator, because I also know that when you do things like that, you're keeping the synapses clicking. So we want to keep all of that going. So that was the worst part. The next part, I had to actually go in, and that was for the lumbar puncture. And for blood pressure, I believe they took blood. Yeah, that was for blood and all of that. Well, I have a needle phobia. And so, of course, I had to ask a lot of questions. How many times had she taken blood? What was the gauge of the needle? How many vials were they going to take? All of that. And in the meantime, she was going ahead taking the blood, and we're just talking, you know, and I'm just babbling about how afraid I am of needles and I don't like needles and all of that. Okay, we get over that. And now it's time for the lumbar puncture. And when the gentleman came in, I do believe it was a doctor, of course I had to interview him. and I wanted to know how many lumbar punctures he had given. When was the last one? Had anyone been paralyzed? Because that was, of course, what I thought the worst, you'd be paralyzed. And he was wonderful. He said that he had given thousands, but he understood my apprehension, and he had me bend over, and I went on to say how I hated needles, and I really was a crier, and if I started to cry, please don't get upset. It's just that I hated needles, and I really wanted to participate and be helpful. And he said, and I said, so when you get ready to do it, let me know. He said, I've already done it. Here's the liquid. I was mortified because I thought that, I was going to have all of this pain. So I had none. So now all of my apprehension is I am totally disarmed by all of this. The last part was the MRI. And I've had several MRIs. So I figured, easy peasy. Now, I must say, it was a bit different because we had to wear masks. And I felt a little disappointed in myself in that I was not able to maintain the procedure for the full hour and 15 minutes, I think it was. I did about 45 or 50 minutes. But they were still able to use whatever it was they needed from that procedure. So all in all, I have to say, all of my apprehension was not found out to be. I met wonderful people, and I now had an opportunity to come and share my experience with you. And I'm hoping that in sharing my experience, you see that there's a real person who had real apprehensions, but who realized that this is important for our population in general, but especially for Black folks. So I want to say it was my pleasure. I look forward to continuing the experience. Oh, and by the other thing, I kept wondering, now, if you know that I have something, are you going to tell me? And of course they said, yes, we will. And then we'll send you to your doctor. So it is an experience that I think if you try it, you'll like it, and you'll find out that you're really being helpful. You're helpful to everybody, and it helps our future. We're it. At the age that I am, if you're looking for somebody that's going to have dementia or Alzheimer, I'm it. So with that, I'll answer any questions.
Thank you, Dr. Tolbert. I loved your enthusiastic testimonial, if you will, for research participation. You look like a very healthy person. You're very enthusiastic, very happy, and doesn't look like we hurt you.
No, it didn't. It really didn't. It didn't. It didn't.
So I think that one of the things I hope that you will have gained today is put a toe in research, participate in our Emory Healthy Aging Program, which is online. And then as you're older, we're going to call you in for additional testing. That being said, if you are interested in research other than Alzheimer's, there's something called researchmatch.com, Research Match. And you put in your information, and whatever it is that you're interested in, they will find a study that there may be a study geographically close to wherever it is you are that you may be interested in. They'll send you emails. In any event, thank you so much, Dr. Tolbert, for your testimony. And I hope you bring some other people, particularly men. I don't care what color you are, pink, white, purple, zebra spots. We need more men in research. And if you are a male on this webinar, this Zoom call, please sign up for our Emory Healthy Aging Study. We have clinical coordinators who will contact you further. Crystal Davis is our coordinator, and she's going to be happy to plug you into any study that we have that's appropriate for you. Thank you. Thank you so much, Dr. Tolbert.
Thank you.
All right. Well, again, we are a research center. Our ultimate goal is to find a cure for memory impairment. And until that time, we are looking for interventions to either stop the disease in its course, or prevent you from getting it. And so with that, Matt, come on, give us 1 or 2 minutes of your elevator speech about CEP, and then we're going to close out with exercise. So at 3 p.m. you can transition to another webinar. All of this engagement too is what we call neuroprotective. So Matt, tell us what we have in store for CEP today.
So in a few minutes at 3 p.m. we have CEP Community Live, is a program very similar to BrainTalk Live. Today we're going to be joined by a PhD candidate from Georgia Tech. She's going to be sharing with us some of her research findings that have come out of the CEP program so far. And she's going to be talking about Google Home. It's kind of like an Alexa voice assistant app where her dissertation in the CEP program, that we've been giving that to people with mild cognitive impairment and people and their care partners, and they've been using it to increase their productiveness and ease of use in the home. So please come. It's been a really exciting program. It's one of our it's one of the most popular sub-studies within the cognitive empowerment program. So we can't wait to see you guys.
Okay, will you drop the link in the chat for everyone? And Dr. Tolbert, Dr. Parker, you guys are getting lots of comments and remarks and thanks. So it's always great to hear a perspective from, firsthand. A worm's eye view is what I like to say versus a bird's eye view. So today you heard it. Even earlier we had Miss Ruth come on, and every week we try to encourage you to participate in research, because we're a research center. And even though we're just talking about these broad, healthy aging topics, we want you to age well. So Matt is placing that in the chat. Go ahead and grab that link. And I'm going to ask John to come on and get us all revved up again, get our energy and our heart rates going as we close out this final Tuesday in January. I keep saying it because it just kind of went by just like that. So, John, if you're on and you can hear me, hi there, hello.
Hey.
I am going to spotlight your video. And let's see there. All right, there you go. Also, if you're still on, go ahead and participate in our poll. That helps us and guides us on, what topics and content we need to cover for the week ahead. And just get ready for February. We're going to cover a lot of information in February. We're still in quarantine here. Not all of us are on campus, so we're making the most of our time, but we're still being very productive. Okay.
All right, let's get this cardio in. I got to turn my hat backwards on this one.